my channel. It's just Jame, and I'm just here trying to change your perspective. Today I want to talk about why it is that I have such a distrust for doctors and medicine. I think that some people think that I just want everybody off their medicine, and I think doctors are so horrible and terrible, and that's really not true. There are several doctors that I have a lot of respect for, and there are certainly lots of situations where I think medicine is appropriate. I'm a nurse. I'm not an idiot. But I do think that we have, whether it's us as patients have done it or maybe a little bit of both sides, both parties, but doctors have a God complex, and we, in a lot of ways, play into that as their patients. We take what they say and we run with it. It doesn't, if one doctor tells you something, for a lot of people, they hold on to that, and man, that is everything to them. If you get a diagnosis for something, it's almost powerful for some people, and I can understand that, but I just think that there is a lack of healing in healthcare. I think that there's an entire world of people who are healing themselves, and it's really unfortunate because they literally are having to heal themselves for a lot of these people. Unless you live somewhere where you're close to a naturopath or a homeopath, or your doctor is just very well researched, or maybe they're an osteopath or something to where they have a broader mindset. For most doctors, it is a pill for every ill. It continues to be that way, and these are just a few stories that I've personally experienced that I think speak volumes, and things that have some of the most powerful stories that I've heard and experienced for myself that have shaped the way that I feel. I work for a pediatric home health company. I love my job, and I'm actually their float nurse, so I see a lot of our patients, which is really cool, and it really gives me a different perspective because I've been able to talk to and get to know so many parents and really get to absorb and learn from them. And so this patient in particular, I had been to her house one other time, but it was several months before, and it was just one time. So I had come back, and this was several months later, and the time before, she had been playing, she was sitting up, all these different things, and her life expectancy was 2 years. We all knew that. She was on hospice. This particular day, she wouldn't wake up. She was asleep on the couch, and she wouldn't wake up, and it got to the point where her family was very concerned. They were getting emotional and really starting to think that she was having this terrible decline. I had not been familiar with this patient at the time. I had done my assessment on her. She didn't appear to me to be anything other than sleeping. However, her mom called her hospice doctor, her neurologist, and her pulmonologist and explained what was going on, that we couldn't get her to wake up. And all three doctors said that it was the disease process just taking its effect. And again, I assessed her. I've seen people die. I did not see what you might call signs of death when I assessed her. So I started asking more questions, and come to find out, one of her medications, and I can't remember now which one it was, but I want to say it was Klonopin. But anyways, it doesn't matter. One of her medications, they had decided they were going to go up on, and so they were working their way up on it, and this was the third week, and it was, I can't remember the leap now, but it was a drastic, it was like a 0.5 milligram per week, or maybe 1 milligram per week, and they were going up to a pretty high dose, and so this was week 3 of 4. And so when I heard that, I started asking more questions, and come to find out, this sleeping pattern had started at the beginning of this third week. And I said, now, I'm not a doctor, I don't know. I said, well, let's just try holding that medicine and just see what happens. And now, before I tell you what happens, I'd like to say that a couple of the doctors said, well, we can hold her Catapress. Well, the Catapress was not a new prescription. She had been on that. Nothing had changed in regards to that dosage, but nobody questioned the new drug. So we held that drug, and by 2 o'clock that afternoon, she was sitting up and she was playing. And that morning, her family was standing around her crying, trying to get her to wake up. And all three of those doctors told us that it was the disease process, without even laying eyes on her. So this same patient, we went to a doctor's appointment at a children's healthcare hospital, and I won't say which one because I go to two of them, so I'm not trying to get people in trouble here. I genuinely am not, but these are stories that need to be heard. You guys need to understand that these doctors don't know everything. So this baby was on a ventilator, and if you don't know, if you've never seen a child on a ventilator, it's a big box, and there's about a 3-foot cord attached to them, and it goes into their throat. There's a tube that goes into their throat. It's very loud. You can hear the breathing, it's breathing for the patient. So her ventilator was sitting on the exam table. She was sitting in my lap. This doctor comes in, looks me dead in the eyes, and says, "Now, is she still on a ventilator?" And this was not his first time seeing her, y'all. This was not, she was not a new patient to him. And I didn't answer because I thought that surely he misspoke, right? So then he repeated the question, "Is she still on a ventilator?" And at that point I just looked at it because I was so, honestly, so flabbergasted. It was like the elephant in there. Of course she is. It's right here. You see her sitting in my lap. And that is the definition of a doctor who is completely disconnected from his patient. He was not in the room with us. He was not present. He was not coherent. And this was the same appointment where he told us we were out of options. And to an extent we were out of options, and she did end up passing away. But to be so disconnected from reality, and in the same visit you're trying to tell us that you have nothing more to offer us. Well, how can we possibly trust you when you don't even know the most basic things about this patient? I have had 2 different preemie babies come home from the hospital and be on our services, and 2 different preemies that go to 2 different children's healthcare hospitals, okay? The one in Atlanta and the one in Tennessee. Both of their moms were told that they needed a flu shot for every month of winter. Yes, that is correct. If you're freaking out the way I was, I had one mom ask me my opinion on that, and I told her I thought she needed a new doctor and possibly a lawyer, because that seems absurd to me. When I became a nurse, I was told that vaccines were for healthy people, and that the reason I got vaccinated was so that my sick babies didn't have to. And now it almost seems like they're doubling down on these sick babies, almost like they're experimenting on them. I don't know anybody who should get a flu shot for every month of winter. And if you're going to tell somebody that and not follow up on all the healthy other things that you can do to stay healthy and prevent infection and illness, I think that you're doing a disservice to your patients. When I was a brand new baby nurse, like maybe had been on the floor for 3 months, I had a patient that got sick, and this was when I was in the nursing home and I was on the long-term care hall. So I had like 30 patients by myself. And I had this patient get sick, and I told the doctor, I said, I think it might be C. diff. And he asked me, one of the qualifications for possibly having C. diff is recent antibiotic use. And I said, he asked me about that, and I said, yes, he was on antibiotics over the summer for pneumonia. And he said, well, I don't think it's C. diff. And I think another week went by before he was diagnosed with C. diff, and then he ended up dying of C. diff 3 weeks later. 3 weeks from the day that I called the doctor, he passed away from C. diff. And I get it that I was a new nurse, and you don't always want to trust a new nurse, but that's just another example of C. diff's not that hard to diagnose. If you've smelled it once, you can almost diagnose it with your nose. And so that was really frustrating. I have had multiple patients, pediatric patients, who have been discharged from services or sort of treated, I guess, kind of badly, if nothing else, for choosing to opt out of formula. And these are not like infant formula. This is like G-tube, tube-fed formula. But for opting out of regular tube-fed formula to do what's called a blended diet, which is basically, most people still use formula, but then they'll blend up different fruits and vegetables to give their child a real diet of fruits and vegetables. And I have had multiple patients be discouraged from that. I myself have asked for that specific type of diet for many, many patients, and every single time I get like this deer in the headlights look, and I've had GI doctors tell me that that's their primary doctor's job. I've had the primary doctor say that's the GI doctor's job. I've had nutritionists say it's the GI doctor's job. It's crazy to me how often the buck gets passed. And we're not talking about anything radical here. We're talking about giving your child fruits and vegetables. And I'll go a step further to tell you that when I worked in the nursing home, anytime we had leftover tube feeding formula, we were forbidden from putting it down the drain in the sinks because it would damage the pipes. But you want me to put it in my patient and not expect any bad or adverse reactions to that. I had one mom tell me that when her son was being discharged from the NICU, the process of discharging, he was being weaned off his ventilator. So they had weaned him off his ventilator, and simultaneously they gave him a vaccine. He had a horrible reaction. They put him back on the ventilator, where he stayed for another month, and they weaned him off again. They gave him another vaccine, even though it's completely counterintuitive, and it states right there in the packaging that if you've had a reaction, you shouldn't get another one. They gave him another one. He had another horrible reaction, had to go back on the ventilator, and ended up staying another month before he was able to be discharged. This one's pretty comical. I had a patient who, his dad was telling me that they were at the doctor that put his son's trach in, that made the hole and put it in there. And his son's trach came out with the doctor sitting right there. And rather than putting it back in, the doctor called for the respiratory therapist. And if you know anything about trachs, like I said, they're pretty important for the people who have them. They are the way that these children breathe. And so the dad said, I said, well, what did you do? And he said, well, I just moved him out of the way and I put it back in. I mean, that's how he breathes. And I was like, well, that's great. I'm glad you did that. But it's comical to me that the doctor who literally prescribed the trach and put it in didn't want to touch it. And you can yell out liability and whatnot, but what about just being a good old-fashioned doctor, Like, where's that at? Where are those skills? I don't care how good you are at avoiding a lawsuit. I care how good you are at common sense and taking care of my patients. I've met several patients who were trached and vented that came home from the NICU and from, not necessarily the NICU, because in order to be discharged you have to go through a whole host of, it's a very rigorous process getting discharged with a ventilator. But from the NICU to the technology dependent unit and eventually home, and they've not been taught, the parents have not been taught how to put their child into tummy time. And if you have bad lungs or if you are on a ventilator, proning tummy time is a really important thing. It's everything, it's how you can drain their lungs. I mean, it just has so many benefits. And they're babies, so they need that sort of development anyways. Any normal baby needs tummy time. And just because they have these respiratory conditions, there's no other reason, at least with these kids, there was no other reason why they shouldn't have been taught that other than they had the trach and the vent. And it's not hard to do tummy time with a trach and vent. You just have to be taught how to do it. And so I've probably had a handful of patients, and that's saying something because in the small amount of patients, I'm probably 40 or 50 that I see or have seen with our company. I mean, that speaks volumes when you extrapolate that out. These are basic care needs of these babies that are not getting met. My own mom was in the hospital last February for a blood clot in her kidney from a dental procedure that she had done. And because of the blood clot in her kidney, what did they do? They gave her an antibiotic, which, sure, That's their favorite thing to do, is give antibiotics. So they said, just in case, we're going to give this antibiotic. Well, the antibiotic made her sick. On top of that, she had just had a dental procedure done, so she was on like a mechanical diet in the hospital. She was there for 5 days or 4 days, and so they kept sending her food that she couldn't eat, and so she wasn't hungry, so she would just send it back. And every time she would tell me, and I said something to the nurse several times, so there was a whole issue just with that, just with her getting the correct food. And then they gave her a second antibiotic because she had such a bad reaction to the first antibiotic, so let's just mix it up and make it worse, right? Throw more stuff into the fire. And so by about day 3, she really felt bad. She had not been eating because, again, they were not feeding her properly. She wasn't getting out of bed because she didn't feel good. She was throwing up, and like, you have to understand, she had reacted to the pain medicine. She had reacted to the antibiotics. She was really having a hard time, and she also has some pretty bad lungs. Her lungs are not in good shape. Not even, she's never smoked. She has bad lungs, they think, from overusing Clorox to clean, actually, with her job. And so, lung health is super important. You need to take care of your lungs. But I say that to say, it was in her chart that she has bad lungs. She vocalized that, I vocalized that, and she still sat in the bed for 3 or 4 days. So by the 3rd day, she started having respiratory issues, and understandably so. Listen, for as long as I can remember, if I lay in the bed too long, my chest will hurt when I wake up. If I take a deep breath after sleeping in one position too long or laying down for too long, where I'm not getting proper chest expansion and lung expansion, my lungs hurt. So there's a lot to be said about exercising your lungs and keeping yourself moving and active. Because she started having some respiratory issues, they wanted to keep her longer, of course, and they wanted to give her a 3rd antibiotic. So they told my mom that they were giving her a 3rd antibiotic, and I think I had gotten there right after that. So I went and asked the nurse, are you going to culture anything before you give her this antibiotic? Like, what is this antibiotic for? And she said, well, she has this lung issue. And I said, she has this lung issue because she has bad lungs, and she's been laying in a bed for 3 days without a spirometer, without getting up and moving around. And so I said, if you can't tell us why you're giving this, and it was a 3rd, like, these were not like 2 of the same antibiotic. This was 3 different antibiotics spread over several days. And if you don't understand, antibiotics are really, they're harsh. They did a study that found that one person in a home with antibiotics, taking antibiotics, they tested surface areas or all around the home, and they found that each person in the home had antibiotic residue. I'm not exactly sure of the proper term. I can't remember. This article I read years ago, but like, I'm going to say antibiotic residue just so we're all on the same page. But they found it on all the people in the home. They found it on the surfaces. So when you take an antibiotic, your body is doing stuff with it. On top of the fact that most of them are taken orally, and 70% of your immune system is in your gut. So when you take that, you're really messing up your gut. And if you don't have good gut health, everything else goes to pot. Your gut health is everything. And so they had just completely wrecked her in the process of this hospital stay. So I refused the antibiotic. I said, we don't want that. We want to go home. If there's no other concern about a blood clot, why are we still here? And they said, well, because she has this lung issue. And I said, well, all you're doing is giving her breathing treatments. We can do that at home, where she's safe. She already would be considered immunocompromised. She doesn't need to be in here any longer than she has to be. And I basically forced them to discharge her. I have another family member who has cancer and was recently diagnosed with low sodium. And for his low sodium, what did they give him? You guys getting a pattern here? They gave him an antibiotic for his low sodium. I know, that's insane, isn't it? Because why? Why not just say try drinking or try eating more salt? On top of the fact that whenever I researched his particular cancer treatment, it specifically lists low sodium as a side effect. But instead, they told him it was because he was drinking too much water, which caused him to drink less water, which caused him to get dehydrated. And this caused a series of trips to the hospital and several other complications that went along with that before he was diagnosed with adrenal insufficiency. I personally spoke to the doctor on the phone, and was told, and I quote, when I asked, what is the cause of adrenal insufficiency? She said, that's the $1,000,000 question. We don't know. I immediately went back to the packet for his cancer treatment, and adrenal insufficiency was listed as one of the top major complications, as well as hyponatremia, or low sodium. And they did, I think, finally admit to everyone that it was the cancer treatment, but that just goes to show you, they will not own up to a lot of times. And the funny thing is, too, the first issue with the antibiotics, he went to the hospital, and every symptom that he had was a side effect of the antibiotic. Because, again, I just did a simple, what are the side effects of this antibiotic? Fatigue, dizziness, loss of appetite, GI disturbances. Those were all of his symptoms. They didn't want to acknowledge that. They did not want to hear that at all. They were, it couldn't be possible that it could be related to his treatment. That just wasn't an option, and nobody was hearing it. And so don't you see, like, when you can't even consider that the solution might be causing the problem, like, they're so unwilling to acknowledge that their medicines and their treatments are harmful that it's almost like they're disconnected from reality or something. I don't know. I really don't know what the obsession is with healthcare and drugs. It's not healthcare at that point, it's sick care. When you are on medicine of any kind, you are not a healthy person. I'm sorry that is me saying that out of love. But if you need to take medicine to be well, then by definition you are not well. The goal should always be to be off of the medicine. And they'll tell you that, but it seems like they don't ever want you to actually get there. Right? Because if you're not on medicine, you don't have to come in for follow-up appointments, you don't have to come in for tests and labs and all these extra little things. When I was a CNA, I had a patient who I took care of every single day. She was on my hall, and after a while, I started to notice that she had this knee pain that was getting worse and worse. And it got to the point that when I would get her out of bed, she would cry. I mean, like, hysterically cry when I would put her pants on. To the point that I started crying. It would make me cry because it was just the most heartbreaking thing. And this patient had dementia, so she could not for herself say, she could tell you, oh, that hurts, but she wasn't going to go around and say, hey, my knee hurts and I need something for it. And this went on. I personally talked to a couple of the nurses. I talked to some of the physical therapists. I went to the director of nursing, and physical therapy didn't want to pick her up. The DON told me that she was too old to be put on pain medicine and it would ruin her stomach. And at that point, this is a quality of life thing, because at this point, she already has dementia. I mean, we're talking about, she one time read pull on the fire alarm and then she pulled it. Okay, like, just because it said pull, she didn't know what she was doing. So, like, at what point are we just trying to help her live out the last few days of her life, however long that may be, in comfort? That's our job. And so this went on for 6 months, to the point that her leg was completely contracted, and she basically stopped using it. She would hold it up in her wheelchair and kind of like tuck it in. And when I started LPN school, one of the first things I was taught was that patients have a right to pain management. That day, I texted my supervisor and said, I don't want to work here anymore because I can't go back in and continue to cause her pain. I've done everything I know to do in my limited power, and I'm not going to work there if we don't get her proper pain management, even if it's just hospice. And so they ended up getting her care then, but it took 6 months and me threatening to quit my job to get her proper pain management. And unfortunately, at that point, it was probably too late. I mean, like I said, her leg was completely contracted. I had again, with the Alzheimer's patients were probably like my first red pill. I always say labor and delivery was like my red pill moment. But Alzheimer's patients, I did a lot of work with Alzheimer's and dementia patients in the nursing home, and I worked in a lockdown unit for a little while, and that was very interesting and very eye-opening. And so as a nurse, I was working on our long-term acute care ventilator trach unit, which is 10 beds, and we were getting like 3 or 4 new patients. And the patient they were putting, they would sometimes put people on the vent unit if we had an extra bed and just until a bed opened up in a couple of days or whatever. And of these 4 patients, the one that they were putting with me was a walking, talking Alzheimer's patient. Now, if you know anything at all about Alzheimer's and dementia, you know that moving them causes a lot of problems. It's very confusing to them. I think it's something like they're 50% more likely to die within a year if you move them to a new location. And I knew that. So when I saw who they were giving me, I went to my boss and I said very respectfully, can we please not move her to my unit? There was like a hip surgery guy that also had come in, and I was like, can we not get that guy instead? Because this woman had been at another facility, had gone to the hospital, and then was coming to us, and we were going to put her somewhere just to move her again in 3 days. And I asked very nicely. I was told no, to which I sort of showed my behind a little bit, and I believe the phrase I used was, y'all don't care about anything but a body and a bed, which got me in a little bit more trouble. But the moral of this story is that patient they did not listen to me. They moved her to my hall. Then on Monday, they moved her down the hall. And then because she was having behavioral issues, because again, she had just been thrown all over creation. And I always try to explain to people, if you were to try to understand what it's like to have Alzheimer's or dementia, imagine waking up in a foreign country where you don't speak the language and you don't recognize anybody. And it's probably still a lot worse than that. Okay, so we're taking somebody who's very fragile. So they moved her down the hall. She was disrupting people, so they moved her to the opposite end of the building. She was still disruptive down there, so then they moved her to a third hall, the last option. Within a month of all of that, she could no longer stand up. She was no longer able to take herself to the bathroom. She ended up not being able to feed herself, she basically just completely stopped functioning and really declined very rapidly. And nobody understood why. There was actually a doctor's meeting when they were talking about her, and they're talking about her lab work and what could be causing this very quick decline. And I flat out said, it's because we've moved her all over the place. She was on 4 different units, on top of being at the hospital, on top of coming from another facility. She's wrecked. We totally mishandled her. We had another patient who, again, had early onset Alzheimer's, and we didn't have a locked unit, and they accepted him as a patient, and I told my boss, I said, I don't know that he's a good fit for us. And they said, well, he was fine at home, he'll be fine here. It's very different at home, because again, once you move them, you've completely thrown a huge wrench in their world. And so this man did not do well. He ended up not sleeping for 30 hours or something like that. Got super combative this was within 24 or 48 hours of him staying there. He got super combative. He passed out, I think, at one point. They ended up sending him out, but not until we called the police. I think the police, or maybe we called EMS. I can't remember. That's right, we called EMS because and he was a tall guy, and they called EMS on him to try to get him transported out to another facility where they could handle him. And at this point, you have 2 EMS people and half the nursing staff surrounding him. And at this point, I'm losing my mind, because the scene was just horrific. He was freaking out. And I finally went over there and I was like, you guys need to back up, calm down, everybody relax. And they still ended up, even though he had kind of calmed down and was talking to me, they still ended up putting him in a chokehold to get him on the stretcher. Where are we at in the world when we need to put anybody with severe dementia? I asked him what he did for a living, and he said that he was in the ocean for 20 years. He was in the Navy, and that's all he could tell me. He was in the ocean for 20 years. That was all he could remember. All of that could have been avoided if we had just had better training in dementia, or just thought for a second about how he was feeling. It was honestly one of the worst scenes I've ever seen. It tore me up, and I'm pretty sure I went in the bathroom afterward and cried, because it just broke my heart. I have a patient who had a short gut syndrome, who was born and basically had some issues where they had to remove part of her small intestine. And sort of the generic treatment for that is they will rotate antibiotics, so she takes a different antibiotic every week. The rationale for that is to prevent overgrowth of bacteria in the small intestines. Now, it takes very little research to find that actually probiotics are more effective at preventing this overgrowth of bacteria in the small intestines than antibiotics are, and probiotics have significantly less harm associated with them. But nevertheless, they continue on with the weekly antibiotic regimen. It's a different one every week, which, again, if you already have a bad gut and you're concerned about your gut at all, that is the quickest way to make it worse. So I always say my real red pill moment in healthcare, when I really realized that we were not as great as I thought we were, was in labor and delivery. For starters, just in nursing school, in LPN school, all I heard were horror stories about labor and delivery, about how all these different women had these terrible experiences giving birth, going through clinicals with labor and delivery. In LPN school was when I probably first got interested in natural birth, and I had started kind of questioning it a little bit, and I had one older nurse tell me she'd been a labor and delivery nurse for like 40 years, and she said it was an inconvenience, that was her word, not mine, an inconvenience for women to go into natural birth, natural labor at this point, because everything was just so scheduled. And prior to getting pregnant, and now especially because women just love to talk about their labor stories and their deliveries and different things, I've just about mapped it out. the pathway that most women go down, which is, they go in, usually your labor stalls when you get to the hospital because it's a stressful moment. You get to the hospital, hospitals are stressful, they're poking you, they're prodding you, they're doing all these different things, so a lot of times labor stalls. Well, once your labor stalls, rather than just giving it some time, they often will start the Pitocin. And what they don't tell you is that the Pitocin really ramps up your contractions. So they're not normal contractions. They are aggressive hyper contractions, and they really happen quickly. And once you start getting Pitocin, it often affects your baby because the contractions are more intense than what the baby is supposed to be feeling, what the normal scenario should look like. And so the baby starts having issues, and next thing you know, as soon as the baby's heart rate starts going down or whatever, and that's usually what it is the heart rate starts to decline, then they rush you into OR for emergency surgery, for an emergency C-section. And all of these women's hopes are crushed. I mean, nobody wants a C-section, right? And so that was sort of my red pill moment, was in labor and delivery. And I had multiple, I can't even tell you at this point, because I've gone through nursing school twice now, with LPN school and with RN school. And so the first time around I was really just more learning and absorbing, because I'd obviously never had a baby, I'd never really been around labor and delivery. But the second time through, I really wanted some more answers, and I was really intrigued, and I was just shocked at the attitudes. And I mean, I can tell you horror story after horror story of just my own friends whose labors went to their labors completely went sideways. Like nothing that they wanted happened. And it's because, in my humble opinion, we do not know how to respect the body. Not in labor and delivery, not in any other aspect of nursing or healthcare. We don't appreciate what all the body can do, how well it heals itself. We don't even understand the aspects of healing that are needed for the healing to occur, right? I can't tell you how many conversations I've had with nurses who don't understand the value of vitamins or of gut health, different things like that. These are not fringe ideas anymore, okay? This is solid research that we know and that has been around, and it continues to grow, and at this point, it's becoming less about ignorance, and it's becoming more obvious that it is about money. Like, you can't feign ignorance forever. You have to at some point say, I'm dropping the ball as a doctor or as a nurse. Like, you've got to try to put in the effort and learn about, I mean, you can't possibly think that we are a healthy country. You can't possibly, in 2021, think that we are a healthy country. If anybody thought that COVID was going to hit hard, you would think it would hit places like Africa, where they have poor health care. Africa did great. I mean, they really, like, you haven't heard anything about Africa in the news. Why is that? Because they've done so well. They've actually refused most of everything that we've done in America. And honestly, that was the straw that broke the camel's back for me, was last year when every single news cycle was death and doom and gloom, and there was not a word mentioned about vitamins, about exercise, about what you should be eating to fight off this disease. For example, just eating like hot liquids can kill the virus if it's in your throat, in your nose. Getting in a hot sauna, that's been proven to kill viruses and bacteria. Viruses and bacteria die at a higher temperature. We know this. And it's like, I mean, that's why you have a fever, right? And it just became so painstakingly obvious to me. Whatever remaining respect that I had for healthcare prior to 2020 just really went out the window. I hear a lot of comments that I'm like, how can you talk bad about other nurses, and how can you're just being disrespectful or whatever, and that's not it. I have so much respect for my profession. I have enough respect for it to be trying to save it. I really feel like as nurses, we're not taught a lot of this stuff. We're not taught how to heal people. We're not taught how to make people better. We're only taught to fear. We're only taught pills and problems. That's it. And nothing empowering comes with that. And I truly believe that if nurses were to start standing up and speaking up about what they see and what they're experiencing, that we could shift the tides on healthcare. Nurses are the #1 most respected profession in the country, and we have been for like 20 years. What are we doing with that power, you know? We shouldn't be making people more afraid. Anybody that is, if all somebody can tell you is to stay home and be afraid of everybody and cover your smile up and don't go out in public and don't be around these certain people because they're unclean, they don't care about your health, or they just are very poorly informed. And I've said it before and I'll say it again, do not take health advice from people who are less healthy than you. Period. If somebody doesn't know how to, if you're talking to somebody who is on 18 different medicines and couldn't tell you the last time they exercised, I wouldn't take advice from them. I'm just going to be honest with you. That's just my humble opinion. And that cancels out a lot of people in healthcare, unfortunately. I just think that there's so much room for improvement. And I really wanted to talk about these. I could keep going. I literally have story after story after story after story of either mistakes or almost mistakes, or just blatant, what I would call, disregard for common sense. I have one of the last stories I'll just leave on this note is I've worked at a facility where they inadvertently allowed me to work 24 hours in it one day. I left, came back, and I was only supposed to work till 11, and the nurse on a different unit, on our LTAC unit, long-term acute care unit, came up to me as I was getting ready to leave and asked me to check her pupils, because one of them was this big and one of them was this big, which is, if you know anything at all, that's a really bad sign. And come to find out, she had forgotten to take her blood pressure medicine. So again, you got to be a good nurse to yourself before you can be one to anybody else. And so she didn't take her blood pressure medicine. Her blood pressure was like 200 something over 100 something. So I was like, well, you have to leave. You can't stay here. So I sent her home. the way that LTAC unit worked, there was only certain nurses that were able to work it just because of the acuity. I happened to be one of the few nurses. The only other nurse that I could get a hold of who worked that unit refused to come in. She was actually the acting supervisor at the time because our boss was on vacation. She refused to come in. I worked 24 hours. I ended up hanging 2 bags of antibiotics on 2 different patients across the hall from each other. I swapped them. Thank God they were the same antibiotic and the same dose, but I actually swapped them and hung them on the wrong patients. And the respiratory therapist that night, he came to me and he was like, "Hey, Jamie, did you know that you did this?" And I said, "No, of course not." I was incredibly upset about it. That so easily could have been a horrible, horrible mistake that I made, and I could have really caused a lot of harm. And I ended up, after that, I said, "I have to go get some sleep." I went and laid in my car for 30 minutes and took a nap. But they don't care about our health as nurses. When I worked in the ER, there was a guy that was giving us report at 7 a.m. and told us that he was coming back at 11 a.m. He worked a full 12-hour shift overnight, 7 to 7, and he was coming back in at 11 a.m. How is that healthy? How is that okay? How are we letting things like this happen, and then you guys wonder why I don't trust healthcare? This stuff happens every day, all the time. You guys put too much trust in healthcare. You guys don't understand that behind the scenes, it's all just a juggling act, and your medical mistakes happen all the time. Okay, your health is your responsibility. I say that all the time for a reason, because they have an incentive to keep you sick. Maybe not the nurses, sure, and I wouldn't even say the doctors by purpose, but I heard a great explanation. The problem with doctors today is that it's like, this is a story that was in a book I read, that doctors today are like a man who sees someone drowning floating down the river. So he jumps in the river to save him, and he brings him to shore. And no sooner does he get him to shore than somebody else comes down the river drowning. So he jumps in and saves them. And this happens over and over, and he keeps saving the people that are drowning. And he's so busy saving the people who are drowning that he doesn't have time to go upstream and figure out who's pushing them in to begin with and causing them to drown. And that's where we're at. Okay? I'm not blaming doctors and I'm not blaming nurses. I'm just saying that there is a broken system here, and nobody's going to fix it but us. And I'm specifically talking to nurses here because, in my opinion, if nurses could be better advocates and know what to look for and what to advocate for, it would make all the difference in the world. Those are just a few stories that I have. Like I said, I could keep going. I feel like I should write a book or something. It's mind-blowing when you start looking for problems, how easily they are to find. When you start realizing that there's a hole and where the hole is, and it's a pill for every ill. It's sick care, and there's money to be made in that. There's lots of money to be made in that. So just think about that. Be considerate of that, and just realize the next time you go to the doctor, ask questions, research, tell them you need a minute, tell them you want to know more. And if they can't give you more, learn it for yourself. I can't tell you how many Facebook groups I'm in that are people who are trying to heal themselves, and their doctors are not very helpful a lot of times. And that's unfortunate. But I don't think we should be mocking people for going out and doing their own research, because there's a major gap in healthcare versus all the other wealth of information that's out there. So anyways, I'm going to stop talking now because this video is way longer than I anticipated, but I feel like it needs to be said. So I love you guys. I'm just Jame. I'm just trying to change your perspective, and I pray that you take something away from this that maybe changes your mind or changes your outlook just a little bit. I love you all. Please comment. Let me know if you have a story that you want to share similar to something that I've talked about today. Like, subscribe, comment, do all the things. You know how it works. I love you guys. I'll talk to you later.